Good afternoon, everyone, and thank you for joining us. I'm Matt Rabalais of the North Oaks Physician Group, and today we have a very special guest. We are speaking with fellowship-trained sinus specialist Dr. Dr LaCour of North Oaks ENT and Allergy in Hammond and Livingston. He is one of only 6 fellowship-trained sinus specialists in Louisiana. We're happy to have you here to chat with us today about some common sinus problems, especially for those of us that live in South Louisiana. We all know the weather is always changing, so very common thing going on for us. So man, just right out of the gate, let's chat about a few examples of some symptoms our audience might be having right now.
Sure.
Okay?
Sure.
So tell me about a patient that has difficulty breathing through their nose at night and might get a couple of sinus infections each year. How could you help them?
So this is super common. A lot of patients say that during the day they breathe well, they're upright, they're breathing well through their nose, but then at night when they put their head on the pillow, they have a hard time breathing through their nose. Sometimes they'll say, I can breathe through my right side initially, and then a few hours later I can breathe from my left side but not my right side, and vice versa. And what happens is a lot of times when those people put their head on the pillow, the blood rushes to the nose, and then whatever they have going on in there swells. And so then they can't breathe through their nose. So if a patient like that comes in to see me, what I'll do is I'll take a look in their nose, and oftentimes we have a little camera that will kind of peek in their nose and see, do they have swollen tissue on the inside? Is there a nasal septum which divides their nose into left and right? Is it really crooked? Or is it just, a lot of times you'll look in there and the lining of the nose is really pale, and that tells me that those patients have significant allergies. Okay, so this is a common thing, and a lot of times these same patients will say, look, doc, I've got sleep apnea. I use a CPAP machine, but I can't use my CPAP machine because I can't breathe through my nose. So we'll look in there and take a look, and then I often will start these patients usually on like a nasal steroid, like a Flonase or something like that. Very common, but what I tell them is a little trick is I have them really pull their cheek like this and then put the spray in their nose and aim it up towards the inside of the eye, and then 2 sprays, and then same thing on the other side. Pull their cheek, it'll open up the nasal cavity, and then put this nose spray in and aim it up and towards the inside of the eye, a couple sprays. I'll have them do that a few times a day and then taper down to once a day, and that often helps significantly. And just doing this, kind of, because a lot of times people just, most of us, we just put it in, spray it a couple times, and it literally makes it about that far in.
I'm sure that's not the directions in the box.
Exactly. And so we'll do that, and then a lot of times I'll come back and they'll say, I'm feeling better. If they're allergic, there's an allergy spray that we can prescribe for them. And so it's real simple. And then if that fails, then we might do a little bit more homework, get a CAT scan, look and see if that really deviated septum, if it might help to straighten that out. I actually just came from a surgery today where a 20-year-old girl had a really deviated septum, and so she did all those things, and it didn't work out because it was so deviated. So we just straightened out her nasal septum, so she's going to breathe really well after that.
Perfect.
Yeah.
Perfect. Well, what about a patient who finds themselves visiting a walk-in clinic multiple times a year with nasal congestion? They have some facial pain as well, and they're being diagnosed with sinus infections, just seems like repeatedly. What can we do with those folks?
So super common in this day and age. I think walk-in clinics get the majority of the patients, quite honestly, because it's Saturday, Sunday, most docs are not available, so walk-in clinic, and so they're probably the front line in sinus patients. So this is great. So patients like this, 3 or 4 infections in a year, a lot of times I'll take a look in there, I'll take a look in their nose, and it looks fine. In between infections, everything looks fine. And then I'll have them come in maybe when they're infected, and I'll look in there and say, yeah, there's a little bit of pus hanging down there, so you have a legitimate sinus infection. These patients, the things that have been proven to help reduce the frequency of infections are saline rinses. As simple as the things you see on TV, just a little saline spray or saline irrigation. Make sure you keep everything sterile. I tell all my patients, use distilled water that's store-bought, keep it in your refrigerator, and only use it one time, only use the bottle one time, and then sterilize the bottle, okay? And keep everything in the refrigerator. That way, I'm sure you've heard of the amoeba in Louisiana, and that's not a good thing. And so that way, we use it one time, sterilize the bottle, and then I usually have patients get 2 bottles, just so they can rotate them. So that's one thing, that's easy. Second thing, nasal spray, just like what we talked about. almost everybody that comes in, nasal steroids will help shrink the lining in the nose and help prevent infections, okay? And let's say we do all that, and they might even have some allergies. We might even get them allergy tested. Let's say we do all that, and they're like, Doc, I'm still getting 3 or 4 sinus infections in a year. All this has been a little helpful, but I'm still getting these bad infections. I would get a CAT scan of their sinuses. And oftentimes with these patients, we'll see that when we look at their forehead sinuses or their cheek sinuses, there will be just a little bit of swelling on the CAT scan where those sinuses drain. It's almost like a funnel. It's almost like the sinuses are like a funnel, and where the sinuses drain can get pinched off, and then that's when those patients get the bad pressure in their forehead or bad pressure in their cheek. So some of those patients, if that's the case, I'm sure you've heard of the balloon procedure, where basically all a balloon procedure is we make the opening of the sinus about 6 millimeters. It's usually about 1 millimeter, 1 to 2 millimeters. And if it's really kinked off right there, we'll pass a guide wire up into the sinus, pass a balloon up there, dilate the balloon, deflate the balloon, and then remove the balloon. And it's now they're breathing better, and they're not getting that pressure, and that can help limit the number of infections they have.
Gotcha. Very, very interesting. Very, very interesting. Well, let's say that you have a patient who's always feeling fatigued, just feeling run down all the time. Feel like they're having a sinus infection diagnosed, say, every 3 months. So in the end, they're just feeling like, I live with sinus issues.
Yes.
What can we do to help them?
Yeah, this is great. We had a patient in fellowship that came in. He was a marathon runner, and he would say, Doc, I can only run 6 miles a day, which to me was fantastic.
I agree.
I can't run a mile, right? And so he's like, I'm used to running up to 20, 25 miles when I need to. And and he's like, yeah, I get these flare-ups, I get a sinus infection, I get an antibiotic, I get a steroid, usually for about 7 days, and then I feel better, but I'm still not feeling 100%, and I'm still kind of lethargic, kind of tired, and so those patients oftentimes will get a CAT scan on them, and we'll see that their sinus problems are not just one little sinus or one little tightening, but they're thickening in the sinuses all throughout their sinuses, okay? So what I would do for a patient like that is I would say, look, you've been on 4 Z-Packs this past year, you've been on 4 steroid packs. Let's do like a 2-week course of antibiotics, okay? And let's see if we can knock this out. Let's see if we can really, if we can culture something from the nose, we'll culture it so we know what antibiotic to give. Sure. Or we'll just give them a broad spectrum antibiotic for 2 weeks and say, hey, how do you feel? A lot of times I'll come back and say, I feel great. I feel great. And I'll say, perfect. We don't have to do anything else. Let's see you back in 6 months. And if we have to do this once a year, so be it. Sure. For those that doesn't work, a lot of times they do need a more thorough procedure, not just the balloon. They actually need to have those little partitions in their nose, which is in their sinuses, which is where all the swelling is. They need to have those removed, okay? And so, and thankfully, sinus surgery's come a long way. Back in the day, when I first started, people were like, I am not getting sinus surgery. Are you gonna put 6 feet of packing in my nose? And I remember my grandfather had this, and they said they would never do it again. We don't put packing like that in the nose. And it's much more, it's like playing a video game. We're looking at a TV screen, and we have instruments that all go through the nose. So those patients would really benefit. Like this marathon runner, when we were in fellowship, he had sinus surgery, and literally, 2 weeks later, he's feeling fantastic. He can breathe better. He feels more open. He's not kind of constantly having that pressure, and the fatigue was gone. And so it's pretty incredible for those that really need it.
Sure, most certainly, most certainly. Well, let's say you have a patient who always stuffy.
Yeah.
But they're also having difficulty with smelling or tasting. Okay. When symptoms are really bad, they feel like their asthma might flare up a little bit too. Yeah. So we're getting more complex here.
Absolutely.
How could we help this patient?
So these are the patients that kind of usually fly under the radar. Like they'll see their lung doctor for their asthma. They'll see their primary doctor for their asthma, maybe some allergies. And upon further questioning, they're like, yeah, I can't really smell, and my taste kind of stinks too. It's kind of, I can't really do that. And so oftentimes we look in the nose of these patients, and they've been living with polyps in their nose for a long time. A lot of times, it's often the guys for some reason. It's also the men that come in and be like, sir, how long have you not been able to breathe through your nose? He's like, about 35 years, right? and so we'll look in there and we'll oftentimes see some polyps. And these patients, when they get like a Medrol dose pack or a steroid shot, they feel great because their polyps shrunk maybe a millimeter or two, right? Those patients, when they get a sinus infection or flare up, their asthma will also flare up. And so I know when these patients come in, if their asthma's flaring up, I know that their sinuses are gonna look pretty bad, because that's usually what's triggering it. And so anyway, these patients, typically we get them allergy tested. They definitely need a thorough sinus procedure to open them up, to kind of help prevent these polyps from coming back. And then the goal of sinus surgery is to open everything up and keep those polyps from coming back. And then basically I tell my patients, we want your quality of life to be up here, right? It's been down here, we want it up here, we want to keep it up here. And so that's, and oftentimes, and whenever we treat these patients, their asthma dramatically gets better.
Gotcha.
Yes.
Perfect. So to wrap things up for our viewers, plain and simple, who would benefit from coming in to see you?
Sure. I would say anyone that struggles to breathe through their nose, right? Anyone that's like, I can't breathe through my nose, whether it be at night, whether it be throughout the day, or anyone you know who sounds like they can't breathe through their nose but won't admit it. And so anyone who can't breathe through their nose, anyone I would say who's getting antibiotics more than 3 times a year. If they're visiting the urgent cares 3 times or more a year, they should come on in and see what's going on, right? It could be something simple. It could be an allergy. It could be something very simple. And so that's the second one. The third one is anyone who kind of feels like they live with sinus. We hear that a lot. I live with sinus. Yeah. Postnasal drip does not mean you have sinus. Most people think postnasal drip is sinus. That's not necessarily sinus. A lot of times that can be a little reflux, a little allergies, right? But what I'm talking about is I constantly feel a little pressure. I constantly feel a little fatigue. I get these flare-ups, but even in between flare-ups, I don't feel well. Those patients, and then those that we were talking about before, those patients who have asthma and sinus, it would really behoove them to come see us, to come see me and basically get a look at their sinuses and see, hey, if we clear this up, this is going to get a lot better. And so those are the patients I would recommend. I'll just a quick caveat. A lot of times patients will come in and say they've got kind of ear pain and sinus headaches. I encourage those people to kind of feel around their temple and feel around their jaw right here. A lot of times if you feel right there, it's actually more so they're clenching. And when they sleep, a lot of times we keep our stress up here. So if you kind of just push around here, they feel a lot of tension. Those patients probably are just tightening up their muscles and having TMJ, believe it or not, so they can spare themselves a visit to come see me, and basically get some physical therapy for this. And we do that here at North Oaks. So most certainly. So, well, folks, they're giving us the go-home cue. That's all the time that we have for you today. We would like to ask that if you'd like to learn more about North Oaks ENT, that you visit our website at www.northoaks.org/breathe. And if you'd like to make an appointment with us here in Hammond, that phone number is 985-230-2778. And if you'd like to make an appointment with Dr. LaCour in our Livingston location, that telephone number is 844-277-8669. Again, that's in Livingston. And breathe easy, folks. It's almost the weekend. We thank you for your time. Make it a great day.